Welcome back to Living Local. Understanding where someone is emotionally, mentally, and physically is the first step in helping someone with a mental illness. Well, what they are going through in life right now can be hard to understand without meeting someone where they are. And to give us some more insight on this is Dr. Whitaker, CEO of Vera French Community Mental Health Center, which is sponsoring this segment. Well, Dr. Whitaker, thank you so much for coming in today.
You're welcome. Great to be here.
Okay, so before we get to understanding more about meeting people where they are, let's talk about the community aspect of Vera French. Vera French always seems to be out in the community working with people in various locations and circumstances even. Can you tell us a little bit more about this aspect of Vera French Community Mental Health Center?
You know, it's so important that we're part of the community. That's in our name, and actually Dr. Vera French wanted to make it that way because she felt like it was so important that we were responding to the community needs. We're not part of a big, larger corporation. We're just beholden to the community. We're owned by the community.
Excellent answer, but that is so true. That is so true, and a much needed resource too in the community. So let's talk about meeting people where they are. It's such a powerful concept. Give us some examples of what it means to meet people where they are.
You know, we felt so strongly about it. We put it on the back of our favorite tie-dye t-shirts for staff.
Okay.
And people love it. It really embodies the magic of what is a community mental health center. Some examples are, we meet people where they are when we don't make them wait for an appointment, when we see them when they need help. That's the key. And you know, our same-day access services, we're able to serve over 2,200 people last year, 2,200 people brand new to Vera French who needed help. Our peer support drop-in center at the Carroll Center was able to serve over 1,000 people last year. People who just dropped in crisis, needed to talk to somebody, and they got to talk to one of our low-pressure problem solvers who meet people where they are. Not where they expect them to be, but where they really are, listening to what they need.
Yeah, and sometimes that's hard for the other person not to, you know, think where they want that person to be. You know, you have to think of, you know, meeting them, like you say, where they are currently. So how is this approach working, and what are your outcomes?
Well, you know, one place that you can see this working really well is in our assertive community treatment team. What that means is it's a team of professionals, nurse, therapist, substance use counselor, employment specialists. They all work together with folks out in the community, people who may at the beginning be experiencing homelessness. You know, 82% of the folks who are now working with ACT were homeless before, now they're not. We also, if I look at some of our numbers here, our ER visits, you know, people going to the emergency room, decreased by 67%.
Wow.
Our psych hospital bed days went from 320 days before ACT to 20 days after ACT.
Wow.
And days in jail went from 188 days before they were working with the assertive community treatment team to 0 after working with the community treatment team.
That's a big change. That's a big change for sure.
It all happens because we're meeting people where they are. We're going to them. We're bringing treatment to them. We're bringing treatment to wherever they need us to be.
Yeah. All right. Meeting people where they are, you know, would be a successful approach to anyone who works with people. So how can people meet people where they are in maybe their everyday work and home situations?
Well, you know, sometimes we get caught up in what we think and our own opinions, and we try to correct everything we hear. You know, if the next time somebody maybe shares something that you disagree with, that you don't really feel is right, rather than just correcting them immediately, why not try validating them? Try supporting them. Listen to what they're telling you. Find a point of agreement. Meet them where they are, and maybe you'll actually be able to help. Maybe instead of creating an enemy or shutting off a conversation, you'll actually start the first of many conversations that give you a chance to make a difference.
That's some great advice. Yeah, and you might learn something too, right?
Exactly. You are going to learn something.
Yeah. Okay, how do you train your staff to meet people where they are when they're working with someone experiencing mental illness or even a crisis?
You know, we've got two main approaches that we use at Vera French. One is called the trauma-informed approach. What that means is that we know that people live through a series of traumas throughout their lives. And a lot of times they're responding to you right now based on trauma that they experienced maybe years ago. And so understanding that maybe there are some good reasons for why they're doing what they're doing. The other approach is the person-centered approach. In a person-centered approach, you really partner with them as experts. You recognize that you can learn from them, that they're the ones who know the most about their situation. So you listen and you let them tell you.
Well, Dr. Rich, as always, some great tips, some great advice that you brought with you today here on the show. Thank you so much for taking the time to talk to us.
You're welcome. Thank you.
All right, again, this segment was sponsored by Vera French Community Mental Health Center. And to learn more, you can check out verafrenchmhc.org. And we'll also have all those details posted on ourquadcities.com.